Hey guys, so today's video is all about physiotherapy and role of physiotherapists in COVID-19. Keep watching. Hello guys, welcome back and you're most welcome on my channel Yash Experience. So in this difficult time of COVID-19, every health professional is dedicated in serving humanity and saving life of different people in different nations. So today there comes a profession which is physiotherapy which comes in, and the role of physiotherapy in COVID-19. So what is physiotherapy? Physiotherapy is also known as physical therapy. It is an allied health profession. It uses mechanism of body movements, exercise health education, mobilization, manipulation, electrical and physical agents. Physiotherapist is basically a person which treats with acute or chronic pain. It improves movement, physical impairments which results from injury, trauma or illness, typically of musculoskeletal, cardiovascular, respiratory, neurological, endocrinological and sports. Even in some jurisdiction, as I've seen in United Kingdom, physiotherapists are also allowed to prescribe medication. When talking about the specialization, physiotherapist is a professional career and which have many specialties including musculoskeletal, orthopedics, cardiopulmonary, neurological, endocrinology, sports, medicine, geriatrics, pediatrics, women health, wound care and even in electromyography. Physiotherapists have been seen in many settings such as private owned physical therapy clinics, outpatient clinics or offices, health and wellness clinics, rehabilitation hospitals facilities, skilled nursing facilities, private homes, educational like in research centers, school, colleges, and even in the industrial areas, in sports training centers, in gym setups, etc. The things which are related to physiotherapy profession. Now we have discussed about physiotherapy, so let me tell you the role of physiotherapist in COVID-19 patients. Well, there are different procedures which can be applied in COVID patients, and most important of them among all of them is aerosol generating procedure. So respiratory physiotherapists are able to perform some sort of interventions on COVID-19 patients and can successfully do the cuff for airway clearance and make all these procedures aerosol generating procedures. Procedures include cough generating procedures, which is huffing or coughing, which you might have heard from your teachers or you might have studied it in some textbook or something. Positioning or gravity assisted drainage techniques, which is really important. Manual techniques like expiratory vibrations, percussion, manual assisted coughing, that may trigger cough or sputum expectoration. And then you can use positive pressure breathing devices which can help you to take out the sputum from the airway. So physiotherapist may be working individually in an ICU setup where he or she may find many COVID patients, but a physiotherapist should not implement humidification, non-invasive ventilation or other aerosol generating procedures without consultation and agreement with a senior doctor, example, a senior medical consultant. Physiotherapists have role in prone positioning of a patient, and it makes physiotherapists a very important person in the ICU team. Physiotherapists can even lead the ICU team where this prone positioning is really important in any COVID-19 patient. These are the few roles of physiotherapist which a physiotherapist can do in any ICU setup or in any COVID-19 setup if he or she gets a lucky chance to do the humanity service. But it is a risk of creating an airborne infection of COVID-19 during treatment. So a physiotherapist should weigh up on the risk versus benefit in completing these interventions and use airborne precautions. So physiotherapists should also be familiar with different types of rooms used in COVID-19 patient. There are basically two types of rooms, class S and class N. So class S is a standard single room with no negative pressure capability, and class N is single negative pressure room with which is isolated. And if there is a chance of airborne transmission from one person to another or infection, so a COVID-19 patient is kept in class N, where there is a single negative pressure isolation room which sucks out all the pressure, and which is really helpful in preventing the transmission of COVID-19 from a patient to the staff working over there. The precautions which has to be taken care of by a physiotherapist is PPE kit and N95 mask, proper fit and its checking. Other precautions are removal of facial hairs for perfect fit of the mask. If there's a male who have beards or mustaches, he should remove the hairs so that the mask can fit properly on his face. While using goggles or face shield, they should be very careful. They should use gloves in all the setup. So if physiotherapist is a girl, she should cover her hairs, or she should tie the hairs back out of eyes and face. If any of the medical staff or any person in COVID-19 is using shoes, then shoes should be impermeable to liquids and that can be wiped down. If anyone is using earrings, watch, mobile phone, paper, pen or stethoscope, they have to be removed. And if it is really required, then you should take the permission of any senior medical person over there. And if you're using any reusable item, then these must be cleaned and disinfected prior to reuse. Whatever the information which I conveyed here today, these are not just merely words. These are all the printed things which have been shown in different articles, on international articles, and these are the information which I gathered from different sources, and few of my friends are working in COVID-19 team in different hospital setups, so they have also shared their experience, and they asked me to make a small video and share the importance of physiotherapist and role of physiotherapist in ICU and in COVID-19 patients. So now, after watching this video, if you're a physiotherapist and you were not aware about what is the role of a physiotherapist in COVID-19 or in the ICU setup, then now you know all the important things. If you want to know more, you can just comment down in the comment section. I'll discuss more things in details if you want to know more things. I want you to share this video at least to your other physiotherapist friends, teachers or any colleagues, any person who is a physio, so that they should be proud of this physiotherapy field. In my video is going to come to an end, so write down any doubt if you have in the comment section. Like my channel, like my video, subscribe my channel, share it as much as you can. And if you want to see more informative videos which I will be uploading shortly, then keep watching my channel Yash Experience. Namaste.